The Cape Flats is home to a number of government clinics, serving a population of over 500,000 people. To help service these communities, government introduced health committees.
So for me, a health committee is a group of interested people who want to contribute to the health of their own communities by getting involved in the health facilities that are provided either by the state or local government.
They are the mechanism to improve accountability. They have a monitoring function. They also participate in planning.
It's a group of people that has been elected by the community to see that their health needs are being met by the health facility.
I will call them almost a middleman between the health facility and the community.
They are more of an oversight committee to ensure that the people get effective and efficient service.
If the community or patients have issues or problems or complaints, even good things, they go to this committee members, and the committee member will then come and discuss it with the manager of the clinic, who will then discuss it with the patient, and they will be able to resolve it like that.
We are the link between the community and the facility, because we need to say this is what the community feels is needed at the clinic.
Health committees, also known as clinic committees, health facility committees and health forums, were established by law in 2003. It is comprised of the facility manager, members of the community, and the local ward councillor. While it's compulsory for each clinic to have a health committee, there is still much debate about their actual function.
There isn't, I would say, real communication between the staff and the health committee. I think if we want to get involved with the things within the clinic, and the staff should have an understanding of this is the role of the health committee.
It is important for everybody to follow their roles and responsibilities so that there can be clear understandings amongst the parties what their roles is and the role of the facility, so that there can be no overlapping and tramping on one another's toes.
Health committees have a commitment to both facility and community. Their primary goal is effective service for the community.
While there might be a number of things that are prescribed for health committees, it's all really about people participating in their own program.
The difficulties working with the health committee is to also still realize that they are also part of the community, and sometimes they tend to be biased in the sense that they're not objective. They just take the view of the community because they come from this community and see the staff of the clinic as outsiders.
I think that people often complain that they don't feel respected. And so that's why I think it's really important to inculcate a mutual respect for each other.
They say the nurses think that, the health committees are coming to take over their management role, especially with the facility management. They think that the health committees, they want to bully the clinic staff, they meddle into their affairs, and they just want to be involved in each and everything that is happening within the clinic.
There must be togetherness in order to have a successful working relationship. So if they don't trust one another, how can you expect there should be good cooperation? If they don't respect one another, how can you ensure there's good cooperation? Working past each other is not going to solve the problems.
Depending on the relationship between committee members and facility staff, very different outcomes are achieved when it comes to patient care. Narisha Naika approached her health committee when she was treated rudely by a nurse at the clinic.
I was alone with him. We walked up in the rain. And when we get there, I went to the front desk to give their card in. It was around 1:30. The sister said to me, we're not going to see to her because it's after 1. We don't see to her age after 1. And I just carried on waiting. And then they said, no, they're going to see to her now and just don't make this a habit. And then one of the sisters came out and they checked the temperature and they found out that, this child has a fever of 38.9.
After lodging a complaint with the health committee, Narisha was contacted by the facility manager.
The next day, I got a call from the sister, the manager in charge. She was very friendly. First of all, she apologized to me and she said that her door is always open. If I do have a problem, her door's open, I should come there and tell her what the problem is and we both will go through this and resolve it together.
While Manenberg may have a good partnership between committee and facility, this may not always be the case. Trainer Fundiswa Kapido was called in to mediate a case after a patient had taken her baby to a clinic in the morning and was still waiting to be seen to at 3 in the afternoon.
The day went by without the baby being attended to. So the mother panicked and she went to approach the nurse about her concern that she has been waiting in the clinic and nobody said anything to her and she was never attended. And her baby had developed a fever and some mouth sore and she couldn't swallow, the baby couldn't swallow. And then the nurse said very angrily in a very rude manner that, we can't see your folder, you have to come back the next, the following day. The nurse was very rude and she shouted and swayed and the client also swayed back because she was very frustrated and angry.
The facility manager was then called to sort out the argument.
The facility manager said, in terms of our policies, we cannot attend to someone who swears at the nurse. So we cannot attend to your baby today. And the mother had to go.
The patient immediately contacted the health committee, who marched into the clinic to investigate the matter.
The facility manager gave her side of the story and said that, this client swayed at one of the staff members and according to their rules, they are not supposed to see someone who swears at them. And the health committees said, irrespective of the client being swearing, but, this is an innocent child and the child is sick and we don't want to see babies who are dying in this clinic. And they demanded that the child to be seen. And, with all that kind of confrontation, the facility manager phoned the area manager who instructed that the child to be seen.
Even in times of conflict, there is always potential for resolution.
I think health committee members can really be so important because they know the conditions under which people live. And so it's not useful for me to tell a young mother to put the medication in the fridge if she doesn't have a fridge. So I've got to think differently and say, so what can I do?
The patients of these clinics live surrounded by unhygienic and unhelpful elements, making good health difficult. For them, gangs, drugs, poor sanitation and poverty are all part of daily life.
We know what is happening in our communities. We know the difficulties that communities are confronted with, the social determinants within communities affect the health of the community. So if there's no cooperation, we won't be able to secure good health for our people.
Many health committee members are actively involved in their communities, and their knowledge and ability to help to educate these communities can be essential.
So you prevent people from getting sick, you will solve the problem of medication, of long queues, of everything.
In order for unity to exist between the two parties, a number of principles need to be established.
I think number one, which is top priority, is respect. I think, the second one is respect between both parties. And another one is transparency.
The relationship that I would like to see is one of respect, tolerance. There must be honesty. There must be understanding of the roles that each of them have.
There must also be a measure of trust between health committee members and the staff. If you have a good relationship, working relationship, and controversial issues come up, then you would feel more free or more confident to raise those issues with the staff and with the facility manager, because of you have this good understanding. If there's a problem, all of us, we must acknowledge the problem and we must agree to work together to solve that problem.
Ultimately, health committees need to be seen as allies, not opposition.
The community can feel comfortable to come and speak with us, to share their views or their concerns about different things. And I mean, we should also feel free to be able to speak with them. And that's why the relationship is so important that the nurses have with the community and with the committee members as well.
They must find a way to respect one another and to be transparent to one another and to develop some kind of trust between them.
Facilities, managers and staff must be clear on what their role is. The health committee members must be clear on what their roles are. And at the end of the day, it's all about providing quality service to the communities that we service out there.
Respect, honesty, trust, communication and transparency. All these things need to be in place to ensure a good relationship between staff and committee.
When people talk to each other and there's a mutual attitude of respect, it doesn't matter who's got the qualifications and who hasn't. It's really about people being in the same way of thinking and talking to each other because they both have the same goal.
At the end of the day, all the parties are working together in the best interest of the patient.
The passion of the health worker, the passion to serve the people in the area makes a big difference.
The responsibilities, is to both parties, both the facility and as well as the health committee, to make sure that there is good and quality service delivery to the patient.
The community, the health committee and the clinic staff, we have to respect one another and appreciate one another for us to form a good role in working together.
Our health committee is a benefit for this clinic.
I think for me the key messages is working together for the health of the people. And that's what we should be doing, whether I'm an educator, whether I'm a clinician, whether I'm a community member, a health committee member, a patient. How can we work together for the better health of the people?